what struck me particularly as you talked about the cyanide cases was your passage in the book Bring 'Em All, the ASAP book that our very own Don Stater was very involved in. And you talked a lot about the need for more awareness, more preparation regarding biological chemical weapons, and how we are in many ways unprepared for that type of a it's not a pandemic per se, but in this day and age, I think we talk a lot about preparation and things we prepare for well, and things that we maybe didn't prepare for as well. Could you touch on that because when you said all hands on deck, and you're trying to protect yourselves from off gassing, and you're taking on potentially a large volume of patients, a lot of that reminded me of your discussion of biological weapons. And could you talk about what a disaster like that would look like, and how we can prepare ourselves as a community for that?
Yeah, so that's actually a super important point and very timely with what's going on today. We so in speaking of biological weapons, there's always this, it's when things are not happening, meaning that there's no biological threat popping up in the world. I feel like we do get complacent, thinking, no, this is not going to happen. But around the world, things like VX gas and sarin gas, every once in a while, these exposures happen. And, those are really difficult to treat. And if you could imagine going to, being here in Denver, going to Mile High Stadium, if there's a sporting event, there's 50, 60, 70,000 people, potentially in that stadium, or downtown Denver, if someone wanted to release some gas like that. You could kill a large number of people. And I'm just not sure that we're ready, that if it happened right 10 minutes from now, what the process is to make sure that we everybody is safe, and where do we move people, and how do we mobilize resources like the antidotes that we would need. There's a particular antidote for gases like sarin and VX. Where are these stores located? Who's going to bring them to the site? How do we keep track of the patients in the area? We've got people that are disaster planners, luckily, and they've got a lot of skill and a lot of experience doing this. But in the case of like a biological weapon like that, the coordination between my group and our disaster planners and our state and local governments and all that, I'm not sure that we're really prepared to coordinate efficiently on the scale that we would need to if we got an attack like that. So, I think that this current, SARS-CoV-2, COVID-19 situation should really be a wake-up call for not just a pandemic, but like you mentioned, like a biological an attack. If that happened, that would be, a terrible. And I'm not for sure that we're ready to attack that. So one of my goals is to I'm fortunate that my Poison Center has a fairly big reach, and I sit between three very large academic institutions with resources and some disaster preparedness. And so one of the things I would like to do when we kind of bring our attention back from COVID and get through this pandemic is to start to really plan for disaster preparedness on the level of scale that we need to for a biological attack, and get our hospitals ready, my Poison Center ready, state, local governments ready, and all that, so that we can meet that challenge when it happens.
That's right. I think I couldn't agree with you more. I think if there is a time in which the public and elected officials and others are going to have the momentum and the insight into preparing for this, it's now, or in the short future, wherein we feel like we have a better handle on COVID, but there's still an appetite for preparation. As you know, and as you've seen over the course of your career, the oscillations of preparation, right? There's always a brief surge when Ebola becomes a threat, and then there's a brief surge, with things like SARS and MERS, and every once in a while, if there's an environmental exposure, there are these kind of waves of preparation and then falling off, and then it's Newton's third law of everything, going to disorder from order, right? But I think in this unique pandemic. I think capitalizing on that is one of our best bets, whether it's creating better infectious disease pandemic response mechanisms and apparatuses, or whether it's chemical warfare, biological warfare. I think this is the time to try and really beef up that infrastructure, right? Because I can't imagine a time in which the public has a bigger appetite for feeling more prepared for disasters like that.
I totally, yep, you're 100% right. Couldn't agree with you more. This is the time to do it and put processes in place that stay in place and that are, maintained and updated and iterated to make sure that we're ready. Because it's going to happen at some point. It will happen. Who knows when? Can't see into the future. But I don't see a time when, I don't see how it would be possible that something like that would not happen.
That's right. That's right. Has COVID changed your job or your practice in any ways, either expected or unexpected, whether it's having to talk to people about hydroxychloroquine, which, 6 months ago was a drug that, unless maybe Chris, you frequently deal with malarial patients, it's not a huge portion of my patient population, but whether it's hydroxychloroquine or the new drugs or other ingestions, has COVID changed your practice in ways that you would have predicted or not predicted?
Yeah, so it's interesting. I just talked to someone about this recently. So, I'm with you. The number of malarial patients I've seen, like coming and presenting to the emergency department has not been very not numerous. So, what for a poison center wise though? I think two major things have happened. Or actually, let me say three major things. 3 points about for effective COVID. One, it's interesting if you look epidemiologically at like big kind of crises and disasters, like Hurricane Katrina. And if you look at this particular SARS epidemic, and if you look at the Great Recession that happened recently, if you look at these big events, call volume to our poison center increases. And we think that part of the reason is that, people in those times were vulnerable. And so some of the, self-harm attempts from medications and things like that go up. And so that's one thing is our volume has increased since this COVID crisis has occurred, which is pretty predictable, because we've seen it before. Second thing, and talking about like chloroquine and hydroxychloroquine. So, some recommendations were made previously about potentially the benefit of, either one of those anti-malarials, chloroquine or hydroxychloroquine, to prevent or treat, COVID-19. And that we've seen an increase in the number of calls to our poison center about especially hydroxychloroquine. And it's both questions as well as exposures that happened where there was an adverse effect. So we've had both of those, like questions about hydroxychloroquine, the drug, and then questions from providers calling us to say, hey, this person overdosed on hydroxychloroquine. So both of those things have happened. In the case of chloroquine, there was that sad case of the gentleman in Arizona who took some chloroquine phosphate from an aquarium cleaner and tried to treat himself or prevent himself from getting COVID-19. He took that and ended up dying from that. And we also have had a couple of cases here of chloroquine overdoses, and they are really difficult to treat. Overdoses of those anti-malarials. Those are some of the drugs that we refer to as, the keep you up at night drugs. If a patient overdoses on that makes you worried because they're tough to treat. So we've had that. That's the second piece, is that both of those drugs have popped up. And then the third thing is, this is the Swiss cheese effect that, number one, kids are at home more now because schools have been out. Number two, the recommendations are to clean all your surfaces. So sales of things from like Lysol, cleaners from Lysol and Clorox are up. And so exposures to bleach and other cleaners are up 20%. Year on year, if you look to February, March, April, year on year, they're up 20%. So we've been dealing with that very frequently. And I've put out a couple of press releases and things out about not drinking bleach because it can be very harmful, and you should not do that. There's no evidence that drinking bleach will help you with treating COVID. So we've had to do that. So those three big things have changed our practice. So to the point, we talk to our agents on phones. I've talked to my medical toxicology fellows, the learners. We talk to them about it. That we're getting calls about this, and so we're trying to educate the public about those things.
Absolutely. Thank you for that insight. Many of the unintended consequences of quarantine, certainly, and
yes,
your perspective on that is so helpful. You just have a better sense of what the numbers look like. Like you said, you can compare it to year over year, and it's something that as things slowly reopen, I think I'm hopeful to see a downtrending, but it's not going to be anytime soon. I mean, I think there's that risk, and the risk of those exposures is going to continue to be present in the community. Thank you for the work you've done to bring awareness to that and to promote that, on a wider scale.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.